good afternoon. I'm Jamie Burbano and I will be doing the routine demonstration of removing the indwelling catheter. So the first thing that you need to do, of course, is the assessment. So what is the assessment? It is in order to assess the client's ability to cooperate with the procedure. So it is in order to determine how the procedure will be carried out. Then, of course, you need to assess the working area if it is well lit. And then you need to determine what preparation that needs to be done in order to ensure the successful procedure.
So when it comes to planning, the first thing that you need is prepare all the materials and supplies that you need. It is in organized materials which facilitates easy access during the procedure. So the first thing you need is syringe and ammo, the non-sterile gloves, the protective pod, container, the towel and washcloth, and soap and water, and your renal bed part if it is ambulatory. If it is non-ambulatory. Then, going to implementation, of course, you need to identify the client and explain the procedure of what you're going to do. And it is in order to alleviate the anxiety and gain the cooperation of the client. So, of course, we need to provide the client privacy by closing the curtain, of course, the door as well. And then, after that, you need to wash your hands and check the healthcare provider order and unit protocol. So, it is in order to ensure that the correct client and treatment that you're going to do with him or him. So, identify the client and explain the procedure. So, mamahal ko po bang itanong ang inyong pangalan? Ang inyong edad po. Saan po kayo nakatay? Thank you po, ma'am. So, after that, you need to remove the cover and drape as to expose the catheter. So, ma'am, tatanggalin ko lang po ang inyong in order to protect the privacy and demonstrate the respect for the clients. So, as I wash my hand, I need to put on the non-sterile gloves. So putting on the non-sterile gloves or gloves, it is a practice to standard precaution. So after that, you need to place a protective pot under the client's hand. It is in order to prevent the bed of the patient from becoming soiled. So I will be placing the drape for the client. So next is I'm going to empty the urine and tubing into the catheter bag. So it is in order to prevent leakage from catheter onto the client when catheter is already removed. So after that, I will remove any tape that will be holding the catheter to the bed. So it's in order to allow easy removal of the catheter. I will remove the tape. And then dispose it. So after removing the tape that will be holding the catheter to the leg, of course you need to insert the syringe and into the balloon port. And of course you need to remove all the air fluid from the balloon. So generally 5 to 10 ml. Do not cut the port, but on some system, the port should flatten out as all contents are evacuated. So I will start to insert the syringe into the end balloon port, and remove all the air from the balloon. Because keeping port intact ensures that the ability to drain the contents of the balloon. So cutting the port, it does not always drain the balloon, but once the port is cut, there is no other way to drain the balloon. As I said, it is usually 5 to 10 minutes. So after doing it, you need to ask the client to take deep breath at the table and then smoothly remove the catheter on expiration. So stop at hit the resistance and recheck the balloon port. So ma'am, hinarap ko ngayon ng malalim at natagaling ako. Ito. Okay. So, of course, as you remove the catheter, you need to note any sediments or mucus or blood that may be on the catheter. So, if needed, culture tip of the catheter by cutting off with sterile scissors, placing it in the appropriate container. So, as I see, there is no mucus or any blood that is visible. After that, assess for any indication of infection or trauma related to the catheter. So, of course, after you remove it to the client, you need to dispose it. So, after doing that, or after removing the catheter, proceed to plant the perineum area or provider one or moist cloth with instructions for self-cleaning. So you need to remove and dispose all the materials, and of course remove gloves, wash hands, cover the client, and put the position in comfort. So I will do first the cleansing area. So you need to wash and with soap and water. You need to wipe it. Okay. So for cleaning, of course, you need to start with the inner before the outer. And then after that, you need to dispose of moisture. I just put it off. So I will put back the cover of the patient. So you need to tell the patient if she is comfortable to her position. So ma'am, komportable po ba kayo sa position nyo? Ito, sige po. Angat na lang po kayo. So of course, you need to instruct for self-cleaning the patient. So doing the cleansing part in telling the instructions to the patient of self-cleaning, and of course the getting back the position of the client, it is in order to provide the privacy and comfort. So it reduces transmission of microorganisms. So that's all. Thank you for watching.